Hello, everybody. This is Dr. Ryan Kavanaugh from Atlas Therapy in State College. I am coming to you today to discuss some part two lung activities that you can be doing. If anyone has been sick with the COVID-19, or if anyone's just looking for some tips on breathing exercises and things to kind of get your lungs stretched out and moving, that is what we're going to talk about today. So the first things first, we've already gone over some diaphragmatic breathing activities. So just to review that, what you want to do is kind of smell the flowers, as we say. So you want to breathe in through your nose and then breathe out through your mouth, blow out the candles. You want to make sure that your stomach here is expanding more than your chest. So it helps put your hands here so you can feel whether your chest is getting bigger or your stomach. You want your stomach to get bigger. So the stomach hand should come out further than the chest hand. So we're just doing this to do some warm up. Again, in through the nose, belly out, and then out through the mouth. Nice big breaths. So we take a few of those to get warmed up and get started. Another thing we're going to talk about here, let's say that you do have some fluid and stuff going on now, or some drainage, and now you feel like you need to cough. You've done some exercises. So I'm going to show you some coughing techniques. For this, you can use a pillow if you need to. Sometimes that's helpful to kind of hug a pillow. You see a lot of times people that have had heart surgeries and things like that will hug the pillow. The reason for that is to kind of help hold the rib cage together. But in this case too, sometimes hugging just makes things a little more comfortable, helps to hold your ribs and muscles together a little bit more comfortably so you can perform the cough. So a good way to do a productive cough technique is to, you can kind of breathe in nice and big, and then when you go to cough, crunch down and squeeze the pillow and just kind of let it exhale. Now again, safety first, you don't want to be coughing on anyone, so make sure you're doing this in an area where if you need to cough, you can either wipe down the surfaces in front of you, or you're not coughing directly on anyone. But again, with that, we want to deep breath in, squeeze the pillow, and cough and exhale all at the same time. Another way to do this too, talking about some of the lung stretches, when your chest expands, your lung balloons get bigger so they can take in more air and expand out. When your chest or everything crunches down, the balloon of your lungs also crunches down, which helps to force the air and fluid and things like that up and out. So if we're talking about coughing, one of the things you can do is even just to stretch out your arms. Arms up nice and big, deep breath, and cough as you come down on the exhale. As you can see, even I am getting some things working and moving and draining this morning. So that's a good way to do some coughing. I'm going to show you some ways to do some lung stretching. So we've gotten some questions about lung tissue and being able to stretch out your lungs. And again, the way to do that is to do some of these activities where you expand the balloon and then contract the balloon. So just like you would stretch a muscle and then like bend the elbow to let the muscle come back together, we're going to stretch and then contract your lungs. Different ways to do this. I have a chair here with two handles on each side. You can do straight up like I did. Raise your arms up nice and big, big deep breath in, and then nice big blow out of the air as you're bringing your arms down. You can do this in any direction. You can do arms out this way, big breath in, and then exhale as you bring your arms together. What's nice about this chair is if you know you have one side of your lungs is tighter or more effective than the other, you can also do single-sided lung stretches. So I'm going to show you those a little bit here. So we have hand rests on this side to give us something to lean over against. So now what I'm going to do is I'm going to lean to my left side. And as I do that, it's going to expand the right side and it's going to compress or contract on the left. But anyways, looks like this. We're going to take a big deep breath in. Reach up with the right arm, kind of bend to the side over top of this handrail, and then do the same thing with the left side, going to the right. Big deep breath in, reach up with the left hand, and then expand or contract and exhale as you're coming back down. So those are a couple different ways that you can stretch. You can use the back of the chair as well. Let me flip this around. I have a nice back on this chair. I can lean back onto it. Big deep breath in, put the arms up, and then exhale as I come back together. Move this back around. You can also do this at a table. I have a table in front of me. Another way to use is the table. So if you were sitting at your kitchen or dining room table and chair, I can rest my arms on the table in front of me. Big deep breath in, you can go the whole way. Exhale and stretch as you come down. You can also do some leaning on the table. If I'm doing it this way, take a big deep breath in as I reach out onto the table, and then as I come back up, it compresses and I exhale. So breath in, stretch, hold it, and then exhale as my arms come back up. The table, similarly to the chair, where I can do one side of my lungs more or the other side of my lungs more. You can also do that on the table. Feeling a little bit more towards my right side, I get more stretch on my left lung. If I lean a little bit to the left side, I get more stretch on the right lung. So that's also a strategy, as well as using a kitchen table and chair. So all different ways to kind of stretch, do some coughing, get some fluid movement, things like that. If your lungs are feeling tight, just like any tissue, it needs to stretch and expand. Also, the muscles around your ribs, your intercostals, we call them, those all need worked out too. A lot of times, if you've had tightness, any people that have been on ventilators, chest tubes, things like that. So all of those adhesions and soft tissue restrictions can cause you to not be able to physically expand and contract your rib cage and your lungs and things like that also, which can cause tightness. And all these things can be stretched just like anything else, just like you would stretch a hamstring, stretch your calf muscle, stretch your arms. All of that is soft tissue. So the more you do this each day a little bit, the better it'll get. So don't feel like, too, if it's really constricted and you can only do like just little breaths and you can only hold it for a couple of seconds, then that's fine too. Try to work each day till you can hold longer and longer. So maybe I can only take a deep breath in a little bit, hold a second, and then I have to exhale. That's fine. It's a good start. You want to do these nice and slow and try to get as much stretch out of your lungs as you can when you're doing them. So later on, a few weeks to months later, what you should be able to do is take that deep breath in, hold a little bit longer, hold, and then. So just like you would hold a stretch on a muscle, you want to hold the stretch on your lungs as well, or hold that air in those lung balloons as long as you can. And basically that will help work your conditioning back. It'll help you be able to hold your breath. It'll help increase your lung capacity so you don't get so out of breath as before. Again, if anyone has any questions, feel free to contact the office. I hope everybody is doing well, be well, and stay safe out there.